Holy am I supposed to know this? You're now a placental expert.
You're tightening up.
This is a non-negotiable, do not pass go, do not collect $200. But now at the dinner party, you can be like, oh yeah, let me tell you all about cervical exams. Like, I didn't know that wasn't normal. Anyway, I digress. Do you ever find yourself around people and they're talking pregnancy and these are things that you think you should know, but you don't know them? Well, today I'm gonna go over 3 things that people think you should know, but you might not, but you will after today. I really don't know why anybody thinks that anything is common knowledge when it comes to pregnancy and childbirth, because I didn't know anything about pregnancy and childbirth before I worked in labor and delivery and before I became a parent myself. So today I'm going to go over sort of 3 things that are pretty basic knowledge that you can sort of soak in, and then at your next dinner party you can spill that knowledge and sound like an absolute birth expert. My name is Tina. I'm a certified perinatal nurse. I'm also a certified breastfeeding specialist. If you are new here, welcome, welcome. Please consider subscribing to sort of be around all of the chaos moving forward. And if you're not new here, thanks for sticking around. The first thing I want to talk about that people think you should know about, but you might not, is your placenta. Yeah, the big bad muckaduck that comes out after your baby. Well, people seem to think that you should know about this. But again, unless you've had a baby and you have birthed a placenta, or you're like me, you work in labor and delivery and you play with them every day. Well, I don't actually play with them, but I do look at them because I think that they're really cool. Anyway, you wouldn't know about a placenta unless you need to know about a placenta. So let's clear it all up today. This is your placenta. It is a really, really cool organ. It's actually the only disposable organ, meaning your body makes it, then your body uses it, or more so your baby uses it, and then your body gets rid of it. It has one function, and that is to support the growth and development of your baby during pregnancy. So the placenta is actually created in early pregnancy from the same cells that are dividing, creating your baby, which for me is always, and then this essentially becomes a life support system for your baby. So it's going to transport oxygen and nutrients and hormones to your baby, and then take waste products away from your baby, allowing your baby to grow and develop during pregnancy. And a lot of that transport happens via this mechanism here. This is, of course, the umbilical cord. And in most cases, the umbilical cord, it's going to insert sort of right in the middle of the placenta on the baby's side, though in some cases, it actually is going to insert off-center, maybe closer to the edge of the placenta, and in those cases, it would require closer monitoring to make sure everything is going well with the pregnancy. And then, of course, this umbilical cord from the placenta will attach to your baby right about here, and it becomes your baby's belly button once they are born, and that cord is clamped and cut. That already sounds like an impressive resume for an organ, but as if that's not enough, your placenta also secretes hormones into you and baby's circulation that affects baby's growth and metabolism. It also protects your baby from infections and maternal diseases, so it's a little bit of a bouncer as well. Now, once you give birth to your baby, if you're into it, ask for a tour of your placenta. I love giving tours of placentas because I think this is a really, really cool organ. So what you'll notice is, on one side, it is very, very rough. This is the side that's all rough, that was attached to your uterine wall, and your uterus was the one that was supplying it with all of that oxygenation that it needs to stay alive and help your baby. And then on the opposite side, inside the bag of waters, is going to be a smoother side. This is almost like a little pillow for your baby to nestle in while they are in your belly. That is the baby's side, and that's also the side where the umbilical cord will be inserted into. So now you know a little bit about the placenta. You can offer that into the conversation, and you're now a placental expert. The next thing I want you to be up to date on are vaginal exams or cervical checks. And again, this was not something on my radar until I was heavily pregnant, laying on a table with my pants around my ankles thinking, oh, this is a thing. Is this gonna hurt?
Okay. You're tightening up.
And the short answer here is that yes, they are uncomfortable. But again, this is a subjective thing because pain is subjective to everybody. So for me, yes, I found them incredibly painful. They were not a walk in the park. But some people that I have worked with, they've had a cervical exam and then they said, oh, well, that wasn't so bad. So I can't tell you what it's going to feel like specifically for you, but what I can tell you is why we do them and what to expect. I want to tell you something, and it's really important, and that is informed consent for a cervical exam is imperative. This is a non-negotiable, do not pass go, do not collect $200. And I think that informed consent in any medical situation is obviously very important, but when we're talking about vaginas, vulvas, cervixes, these are really sensitive areas, and it's also a really vulnerable time for somebody who is pregnant, so it is incredibly important. Please keep that in mind. And I'm just gonna check your cervix. that is not informed consent. Informed consent should include why they want to do that cervical exam and why they want to do that cervical exam right now. Like, what about this moment is this exam going to tell you that's going to change your plan of care moving forward? Now, if you've consented to the cervical exam, you're going to lay down, and then the first thing I need you to do is take off your pants and underwear. And I know you're like, Tina, that's pretty common sense. But I'm telling you, it's like you lay down and this fog comes over you, because if you've never had a cervical exam and you don't know what to expect, you're thinking 8 steps forward. You're thinking about what's it going to happen? How's it going to feel? You're not thinking, oh, yeah, how are they going to get in there? So first thing, take off your pants and underwear. And if you forget, you are not the first. You will not be the last. I promise you, you're not alone here. Once you have your pants and underwear off, we're going to help you position your legs. And this will either be with your feet flat, with your knees sort of flopped sideways open a little bit, or we do like the froggy leg where you put your ankles together and then you let your knees flop completely open. And that's just to give access and try to relax everything from the waist down. And the more relaxed you can be for this, the less uncomfortable it's going to be for you. Your provider then will put on a sterile glove, and then they will lubricate these 2 fingers. So these are the fingers that we utilize to do a cervical exam, because they tell us a lot of things about your cervix once we get them in there. So they're going to lubricate these 2 fingers, and then they will go ahead with the exam. I always ask again that it is okay that I do the cervical exam, because I want to make sure that you are ready mentally, but that you've also sort of cleared everything in your head and you are ready to proceed. I will always touch an outer thigh or touch a labia before I insert my fingers, because I think that that's good to feel the touch before we just go straight in there, because that can be quite jolting and quite alarming. And then once we are good to go, we will then insert our fingers into the vagina. Once my fingers are inside, I'm actually looking for your cervix so that I can assess it. But I'm going to tell you something. A cervix that is not in labor or a cervix that hasn't had a baby yet, sometimes these cervixes can be quite far back and a little bit difficult to find. So first things first, if you take your fists like this and you pop one under each of your bum cheeks, that's going to work to sort of tilt that pelvis, which might make it easier for me to find that cervix. But very importantly, I want you to know, during this exam, if I have to do a lot of manipulating or for any reason during any cervical exam, if you are uncomfortable, a simple stop or done or get out, anything that you need to say to communicate to your provider that you are uncomfortable, that should signal to them to immediately stop the exam and remove their fingers. Please keep that in mind, because informed consent matters, and you can change that consent anytime throughout the exam if you are uncomfortable. Now, once I do find your cervix, I'm checking for a few different things. The first thing I'm going to be checking for is how far back that cervix is, because it actually moves forward as labor progresses. I'm also checking to see the consistency. Is it really, really firm, or is it starting to soften up and get a little bit stretchy? And then the 2 that you might be familiar with that I'm checking for would be dilation and effacement. So dilation is, of course, going to be how open or closed it is. And I'm going to tell that by how many fingers I can get in and how far apart I can move my fingers. So your cervix, when it is not in labor, it's going to look kind of like this. It's going to be thick, it's probably going to be firm, and you can see here, it's going to be closed. So I would not be able to get a finger in here, and I would say either it's a little fingertip with this divot, or it is closed. Then as your labor progresses, you are going to start to open that cervix more and more. You can see here, this one is starting to open. Okay, I can get almost 2 fingers in there, 1 for sure. So I'd say that this is about 1 centimeter, and then it's going to continue to progress. Here is a little bit more. This one's 3 centimeters dilated. And then it's going to continue more and more and more, of course, until you get to the end when it is fully dilated, wide open, and ready for you to start pushing your baby out. But dilation is not the only thing we are checking for. We're also checking for effacement, which means how thin or how thick it is. And so you can see here, this one quite thick, right? If I put my finger here, it's almost to that knuckle. It is quite thick. It is 0% effaced. And then you can see that it starts to get thinner as you dilate, and it starts to get thinner, and then it starts to get paper thin, and you are 100% effaced. Almost you can't even feel it if you don't know what you're feeling for. It feels almost like tissue paper. So we're definitely checking for dilation and effacement as well while we are in there. So when would you have a cervical exam? This is going to depend on you and your pregnancy and your provider. You might have these at your prenatal appointments as you get closer to the end of your pregnancy. If you're interested in a membrane sweep, and I'll link a video up top for you all about what a membrane sweep is. You might also have these as you get towards 40 weeks to sort of check your progress if you are interested in that. You might also have these if you have any issues in pregnancy and they are concerned that you are dilating before 37 weeks. You might also have one of these in labor to check your progress as things are moving through. So lots of times where you might have cervical exams, but now at the dinner party, you can be like, oh yeah, let me tell you all about cervical exams. And the last basic thing I want you to be up to speed on is when you should seek help during your pregnancy. Because a lot of times you'll talk to your provider, you'll be like, oh my God, this happened. And they're like, oh, that's totally normal. And then you'll be like, my big toe just fell off. And they're like, yeah, that's normal after 37 weeks. And you feel like, well, I don't know what's normal and what's not normal. But people are like, well, you should know that that wasn't normal. And you're like, I didn't know that that wasn't normal. Anyway, I digress. I will tell you this, lots of things before 37 weeks or preterm are not considered normal, and that would be a very, very lengthy list, and that's not what I'm going to do here today. So I want you to always have the number of your provider's office or the number of your hospital triage handy as you approach that 37-week mark, so you can always call in and get specific information based on your specific pregnancy and your specific health conditions, because that would be a whole nother video of things that are not quite normal before 37 weeks. First off, bright red vaginal bleeding. This is never normal at any point in time during your pregnancy. So if you are having bright red bleeding, like a period color, I want you to get checked out right away. Now, spotting can be normal, can be abnormal, depending on what part of your pregnancy you're in. Again, if you are less than 37 weeks and you have anything coming out of your vagina, fluid, spotting, bright red bleeding, I don't care what it is, I want you to get checked out or at least let your provider know ASAP. If you are approaching the end of your pregnancy and you notice some spotting, maybe some streaks of pinkish or brown in with some mucus, this can be a very normal sign. This would be known as bloody show. This tells us that your cervix might be doing little bits of changing, maybe a bit of effacing, a bit of dilating, and that's going to come out in any vaginal discharge or mucus that is there. You may also have some spotting that is implantation bleeding in very, very early pregnancy. So it just depends on what's happening with your pregnancy. Follow your gut. If you think it is not right, always err on the side of caution and get yourself checked out. Next up, baby movements. Any change in your baby's regular patterns of movements, this is abnormal, not expected, and you should get it checked out ASAP. Now, some people might say that your baby movements slow down towards the end of the pregnancy because they run in a room. This is actually false information. Your baby's movements should stay the same pattern, the same regularity. The characteristics of it might change as your baby grows and fills up that uterus. So instead of those big rolls over in your uterus, you might feel more punches and jabs. But again, the movements should not slow down. That pattern should remain the same. So definitely any decrease in baby movements should be checked out, but any change in pattern should also be checked out. Water breaking. Off the top, I'm going to tell you, if your water breaks and you are less than 37 weeks of pregnancy, please go in to get checked out. Maybe, call your provider on speakerphone on the way to let them know. If you are over 37 weeks of pregnancy, there's a high possibility that you've actually worked out a plan with your provider on what to do if your water breaks. You definitely want to take note of the time that it broke, the amount of fluid, the color of the fluid, and if there's any odor to the fluid, and also pay attention to your baby's movements, and then sort of follow up with the plan that they have been wanting you to do. So either letting them know or going in to get checked out. The fourth thing that always needs to be checked out are any signs of preeclampsia or high blood pressure. So those are going to include any sudden onset of a headache that you can't get to go away, visual changes, so blurred vision, double vision, spots in your vision. If suddenly your vision is different, you need to get that checked out. This also includes nausea and vomiting. It includes any sudden swelling of the face, hands, and feet. And I'm not talking like regular pregnancy swelling. I'm talking like, holy Dinah, what is going on? And this will also include any blood pressures that are over 140 over 90. These are all things we are not messing around with. You go and get checked out. And the fifth thing, I call it my hot pot. I throw everything else in there, starting with a fever. So if your temperature is greater than 100.4 Fahrenheit, or for my Celsius girlies, 38.0 degrees Celsius, at minimum, I need you to let your provider know and then follow their directions as to if they want you to get checked out. Very important, your heart and your lung system. So if you are experiencing any chest pain or a racing heart, or you are having shortness of breath, trouble breathing, maybe you are dizzy, lightheaded, maybe you have passed out, or included in this area, we're also talking about redness and pain in the backs of your legs, in your calves. These are definitely things that need to be checked out, and if you are very concerned, please do not hesitate to contact your emergency services or call 911. And then lastly, excessive nausea and vomiting, because let's be real, you need to be able to eat and take in fluids to keep yourself healthy, but also to keep your baby healthy. So that is definitely a reason to go in and get checked out as well. And also, I made you a little cheat sheet because I'm a visual learner and I really appreciate little PDFs. So you can take a screenshot there. I will tell you this, This list is not by any means inclusive. So if at any point in time during your pregnancy you are feeling off, you are feeling unwell, you are concerned for the health of you or the health and safety of your baby, please never hesitate to just go in and get checked out and at least contact your provider, or maybe even do both, because you know what? We would rather see you and not need to than need to and not see you. So always err on the side of caution. So now you're an expert and you can contribute to the conversation instead of sitting there being like, holy shit, am I supposed to know this? I do have a prenatal and a breastfeeding and a baby care course up on my website. If you want to know even more about even more things, go and check those out. Here's a video for you on all the other changes that your pregnant body might go through. So now you're an expert on that as well. If you like this one, show it some love, consider subscribing. And as always, be happy, stay healthy, have fun. Bye.